Good afternoon, everybody, and thanks for joining on our Friday call. I want to start right out by recognizing Senator Julian Cyr, who's able to join us. However, if I thought I was busy, I have no doubt how busy Senator Cyr is and has been. So, Julian, I'd like to turn it right over to you for an update because I know you need to get going soon.
Thank you so much. And you know, we're all, I think, working harder than we ever have, I think, to keep our community safe. And for all of you in the town of Harwich who are just doing incredible work. So hopefully you all get a little time this weekend to recharge. Wanted to provide a quick update on work that State Representative Sarah Peak and I have been leading in concert with our municipalities, with the county, and with our hospitals and healthcare system to begin to look at reopening. This is an effort that's been pulled together. So we've established a Cape Cod reopening task force with leadership from the legislative delegation, all of us, with the Cape Cod Chamber of Commerce and with Barnstable County, with participation from Cape Cod Healthcare, municipal leaders, both town managers, there's representatives of town managers serving on the task force, as well as select board members who are serving on that task force, local boards of health, a few other participants as well. And so that work has commenced. We have several objectives. Most broadly, the aim is that we are lives and saving livelihoods. We're taking our lead from the governor and from the reopening advisory board that the governor established. But it's really important that we are preparing for what reopening may. This is critical both for the public health of the region and our economic vitality. And to do that, we've got to have consistent information. We've got to be pulling from the same oar. We have to be speaking with one voice. Our residents, particularly seasonal residents who are coming here now, and then later visitors when that's a possibility, they don't necessarily adhere to or sort of understand the municipal distinctions between our communities. So we all kind of get that in town and state government, but someone may not realize the difference between Truro and Eastham or Harwich and Yarmouth. And so it's really critical that as a region, we're speaking with one voice. I actually really worry that reopening the wrong way or reopening in a very inconsistent way would put all of us at risk, first and foremost, from a health perspective, and then also from an economic perspective. The good news is we've had some success, particularly in absorbing the influx of population that we saw in mid-March. So just anecdotally, but also we have some evidence to back this up, that we did see a population influx in mid-March of people who initially chose to ride this out here, largely in second homes. There was a lot of concern about that. I was concerned about that. But if you look at the health data and the epidemiology, we didn't see significant community spread caused by that population influx. We're going into now another period, right, where particularly seasonal residents, so second homeowners, snowbirds who are returning, and then seasonal workers. And here I'm talking primarily about Americans who are living elsewhere and may come back. We need to make sure that there's consistent public health messaging for those folks, really around risk communication, making sure they understand that. And so this really is the aim of the task force, to first and foremost, put public health first to keep our communities safe, but also to work in a unified fashion to make sure that, that when we're able to reopen and as So that's the update from me. I know that the Cape Cod Chamber is coordinating and getting feedback with Cindy and other smaller chambers. There's also representatives of law enforcement and fire EMS on this panel. So we're really trying to, get everyone we can involved. We do have a feedback mechanism. So there's a feedback form that's available. I'll make sure that Joe will get that to you and maybe you can disseminate that. But trying to get as much feedback as possible, but just working, as we always do on Cape Cod, in a real collaborative fashion, to make sure that we're keeping our residents and seasonal residents and ultimately visitors safe. I'm glad if there's any questions, I'm glad to take them, but I wanted to make sure that I came on and sort of briefed folks in Harwich about this initiative.
Thank you, Senator, not only for that update, but for the work that you were spearheading. Is that me making that terrible noise?
You are most welcome. Thank you.
All right. Thank you, Senator. Larry, I bet you have a question for the Senator. I saw you raise your hand.
Well, thank you, Julian, and thanks for attending our meeting this morning on the Cape Cod, I always forget the title, Councilors and Selectmen's meeting. After you left, we had a further discussion of how we need a uniform message. And I found that interesting because I think the opinions varied from, I think the direction you're going is we need to return to some semblance of economic reopening, but in a very safe manner. I guess to one side of the spectrum to the other side of the spectrum was almost, I'm probably stating this in the extreme, almost we should shut down for a year and come back next year in fear that if we have a surge, we could ruin our brand. And so even though it sounds like an easy discussion, my hat's off to you because as all discussions, we'll take, give us, it will require everyone having input and sort out what is best for all sides.
Yeah, Larry, thank you for that comment. There's a real, balancing. It's not even a balance actually, but really making sure that we are considering and putting public health first, no matter what we're doing, is really difficult in a place that has a very short summer season, that sees an influx of population. The actual decisions about how we're going to be reopen, and when we're going to be able to reopen, and what that looks like is actually not coming from this task force. It's coming from the governor, and it's coming from informed by the work of this advisory board on reopening. So the work of the task force really is to prepare and anticipate that. So one example is beaches, right? We have a remarkable resource around beaches here. Some municipalities have restricted beach access, others haven't. The Seashore has kept all their facilities or access to beaches and other facilities open. When we have guidance from the state on beaches, we're going to want to make sure that we get that information out in a uniform way. And so that would look like a poster, right? That's available to all towns that we can disseminate. But there's messaging that's available, yes, in English and also in other languages. So the work of the task force, really, we're taking our cue from the governor, because I really feel strongly that, and I think a lot of us feel strongly that, we've got to do this we're inconsistent. If there's variation between towns, we're going to put people at risk, right? So let's use the face mask example. Before the governor took his action, we had sort of a hodgepodge of face mask rules on Cape Cod. I couldn't keep track of, in Provincetown, I'm supposed to wear a mask between this street and that street, and in Yarmouth, I have to wear it in the grocery store, but not here. That inconsistency makes risk communication all that more difficult. And so my aim, and I think our aim with the task force, is that message, the rules of the road are probably going to be decided and should be decided at a higher level, but that we all need to prepare to be able to communicate that. There is not sort of one authority that governs Cape Cod, right? There isn't a mayor of Cape Cod. There isn't, there's 15 municipalities, there's a county, there's various businesses. So, the way forward on this is to have uniform information that we're putting out that's really keeping people safe. And then when we can, allowing things to be opened up. But again, taking our cue from the governor.
Folks, I'm going to put everyone on mute all for the moment. I'm hearing terrible feedback on my end. Are you getting feedback from my audio, or can you hear me?
Just from your audio, Joe. Everybody else is clear. You've got a hum.
Yeah. Yeah, you're speaking over the hum, as Norm says.
So I will open it up for the group. I will drop off and try to do different audio.
Now you're clear. Now you're not.
I have a question, Joe, if I may.
Sure.
Two questions, Julian. One is your idea for day trippers. You referred to snowbirds returning and so forth, but any kind of guidelines for day trippers? Because I imagine we'll have a lot this summer. And two, you referred to people coming back to the Cape, and you referred to them as Americans. So do you want to just describe what you meant by using that description? Thanks.
So, sure. So we don't have guidance on day trippers yet. We don't. That guidance hasn't been developed. It's going to be something I think that's needed. I'm already seeing. I'm just seeing people who are taking day trips because I go for a walk in a place that like no one really knows, and I see people who I know. I just know that they're here on a day trip. So that's something that's going to be worked on and I think available. Again, wanting to, if you look at the guidance we put out to seasonal residents, we didn't recreate the wheel here. We literally just said, here's what's in the governor's orders. Here's what the recommendation is. And then just targeted that information. By workforce, I mean that our seasonal workforce, we get seasonal workforce from around the world, primarily through the H-2B visa and the J-1 visa programs. My understanding is that there continue to be travel restrictions, and I think it's going to be difficult for those H-2B or J-1 visa workers to come here. So by seasonal workers, I wanted to be clear, and thank you for asking the clarifying question, Diane, because it can be a bit confusing. I mean someone who, a bartender who works in New York in the winter and comes to Provincetown and works in the summer. Those are seasonal workers who we expect and I think are returning currently. So that's the focus when we say guidance to seasonal residents. We mean people who are snowbirds, we mean people who are second homeowners, and we mean people who are seasonal workers who are essentially sort of in country, right? We have restrictions on people coming in from out of country, and also there's just limited travel, air travel service. So just recognizing that the H-2B and J-1 visa workforce is uncertain at the moment.
Thank you.
You're welcome.
Senator Norm Clark here.
Yeah.
Just a comment. I think the state and the town has done an extraordinary job of preparing for this pandemic, and I'm confident and I feel comfortable. I live in this community. But having said that, what we're finding is Cape-wide is, for example, the field hospital at Joint Base Cape Cod is closing. Wasn't needed.
Yep.
It was there. Thank God it wasn't needed. That's great. Cape Cod Hospital, I understand, has laid off hundreds of employees. That's a problem. So the number of calls that my fellow chiefs that we've talked about are very concerned are not COVID calls, but you could say COVID-related calls, because we are now seeing a substantial increase of people that are very sick or even dying because we guess are too afraid to call for help or go to the hospital. So we've got to see that trend stop and continue from Boston and from Washington to instill that our people are safe. So we're concerned about that. And I am very concerned as a citizen and as a department head of the economic impact. First and foremost is the safety of all of us. But we have to, I hope that we can move in a safe, consistent process to reopen this economy, because that's going to be devastating. That will have
there were real Herculean efforts that were put into preparing for the surge here. In my estimation, Cape Cod Healthcare more than met the moment. We did better there than a heck of a lot of other places in the state. The furloughs and its 600 workers, look, this is unfortunate, but if you look at other hospital systems across the state, the last hospital systems that actually, many of these systems did furloughs 7-8 weeks ago, and it's purely a function of revenue not coming into the hospital. I mean, they're losing millions of dollars a week. So wanting to make sure that these folks get possible. There also is a need in our skilled nursing facilities for staff. This has been particularly as staff test positive. You need to have other workers coming in. So hopefully there's some opportunity there. I think your point around urging people to seek healthcare is essential. When you look at our emergency room intakes, particularly in recent weeks, most of them are not COVID related. They're an individual who say, maybe had signs and symptoms of a stroke, opted not to go to the emergency department early on, and then is going days or weeks later worse. And so I think it's very important that people access healthcare when they need it. And so that's crucial. And, tied into health and tied into wellness and mental health, is our economy. I really worry that, particularly in a place where so many families make their living in a very short 8-week season, that not having a season or even the muted season I think we're going to have, which is the best case scenario, is devastating. And I know this. I mean, I grew up in a seasonal restaurant. My family owned a restaurant for 30 years. Is going to be is particularly challenging for seasonal communities like ours because, whatever you get to Labor Day, you really have to wait 9 months to really make an income. So we're really trying to address all of this, but to do it in a way that is first and foremost protecting public health and making sure that we're supporting all of you. So I appreciate the comment. And I don't want to monopolize.
As always, you reassure me in that of your being sensitive of what's going on the ground, and I continue, and not just because you're just here on camera. I wish it was in person, but I appreciate the fact that you are sensitive to the day in and day out operations and the day in day things that our citizens do, and so I thank you for that.
Thanks, Chief. And I've got a great partner in Sarah Peak who, we're working hand in glove on this. She's joined these calls. I join these calls. We work. I couldn't have a better partner. So thank you. Anyway, thank you, Joe, for the opportunity to join the call. I'm glad to provide any kind of follow-up questions offline, and just really want to thank all of you for what you're doing. It's made a big difference. I think we've been able to, this is the most difficult situation we could imagine. But I really see Harwich and most of our communities really meeting the moment.
Thank you, Senator, and thank you very much for joining us.
You're welcome.
Folks, what I'd like to do, I'm going to put everyone back on mute all, and I'd like to give some Harwich-specific updates on behalf of our Public Health Director. I want to make it clear, however, any statements that come out of my mouth are mine, so any errors and omissions are mine and not to be held against our Public Health Director. As the Senator had mentioned, obviously we have information on some changes that the governor has made relative to what was considered non-essential, that is still labeled non-essential, but with some qualifiers, so I'll get into those in a moment. I do want to just bring everybody up to date on the latest numbers, both first for Barnstable County and then specifically for Harwich. The numbers that were released last night by the Commonwealth, there are 73,721 cases. We have, unfortunately, a death rate of 4,552 for the Commonwealth. For Barnstable County, we see 1,021 cases, impacting 57 deaths. For Harwich, as we mentioned last week, we know that some of the assisted living facilities and healthcare facilities, when they're impacted greatly. And unfortunately, that's the case here in Harwich. We are aware of the matter at Wingate. So what I'd like to do is just update and identify the two tranches of numbers that we have. The overall numbers that were confirmed by the Commonwealth on Wednesday, and mercifully are still correct as of today, meaning there's no updates. In total, we have 96 cases that have been confirmed with 6 fatalities. That breaks out as 35 cases in the community. I was told by our health director the other day that of that number, we understand that there are only 2 active positive cases out of the 35. So there is, even though that's a larger number than we want, there is some relief that it's far less a current impact. And we did suffer 3 fatalities community-wide. The numbers for Wingate are just overwhelming. 61 cases as of Wednesday with 3 fatalities. So even though we've done well in progressing, we're still in the grips of it, and unfortunately, we're still seeing the effects of it. I do want to talk very briefly before opening it up to everybody on the call. As I mentioned, Governor Baker has made some changes, not the least of which was his face coverings order that went into effect on Wednesday, May 6th. So our public health director, Megan Eldridge, did release a reverse 911 call throughout the community, as well as released information online and through the public media and social media on the expectations and the realities of face coverings. As I said last week, the Board of Selectmen have resumed their regular Monday evening schedules, and we began a discussion on Monday, May 4th on resumption plans. The bulk of the discussion this past Monday was on beaches. Much more to come on that, obviously, with a beach resumption plan being rolled out through administration and presented to the board on Monday, May 18th. The governor overnight, Wednesday into Thursday, modified the statement of non-essential as it relates to golf courses, acts upon municipal golf courses. There is a resumption plan that is actively being vetted that I hope to release to the Board of Selectmen later on this afternoon before releasing it out to the general public at large. However, I would just remind there are a number of strict requirements and guidelines that the governor has attached to the reopening of municipal golf courses and other golf courses. So I do want to put out there that anybody thinking that they will be able to seek the sanctuary of the normalcy of golf, be the first to burst the bubble. It can be very limited access, even at Cranberry Valley in the short term. Stringent requirements on distancing while you're on the golf course. And your round of golf is not going to resemble, in large part, what you're doing in the past because of changes that need to be made to the play of golf and the pace of golf. However, it is a potential bright spot. I know that on this call, I may be looking at 1 or 2 golfers who are anxious to get back out there. And I will tell you that someday when they open up I'll be there to take my frustrations out on a little white golf ball myself. But it is progress, but it's also progress with some significant limitations. And lastly, the major resumption plan we're working on is having town employees return by and large to the municipal offices as early as next week. We're in the middle of retrofitting our buildings with the expectation of being able to open to the public within the next 2 weeks or so. Once we have proper mitigation in place, be obviously signage and sanitizing dispensers, as well as plexiglass and countertop shields throughout. So we are actively progressing towards the resumption of business as we knew it in the early stages of COVID-19. At this point, I will open it up to everybody, but I would ask that you remain on mute if you wish to speak. If you're on video and you can give me a wave, I'll have you do that because I know we're going to have audio issues if I open the microphones up to everybody. But I do want to open it up at this point for anybody who has first information to add to the group, and then anybody who may have questions of me or the group.
Joe, I'll start.
Thank you, Larry.
I'd be happy if my golf game didn't go back to where it didn't resume where it was before. I would think that would be a positive in my case. But just to repeat what Joe said, as a selectman, we're worrying about how do we reopen in a safe way. Next summer is going to be, no one knows what's going to happen. So a lot of our discussion has been on how much revenue we expect to have. We're trying to plan for possibly worst case and hope for the best. We mentioned with Senator Sear the seasonal help. I was interested going back to the meeting I was in this morning. Cindy, this probably is interesting you as much as anyone. A couple of the town administrators / managers commented that some of their businesses were unable to get and with a $600 federal funding helping out, they're paid better to stay unemployed than they are coming back and work. So they're struggling opening up to get the help, even locally.
Can everyone hear me okay?
Go ahead, Cindy. Yep.
So, Larry, in regards to that, I was on a call yesterday with a number of the other chambers throughout the Cape and the Mass Business Development Office as well. And yes, some places are hearing from their employees they like being on unemployment because of that additional $600. But that does run out July 31st. So with that being said, you want to encourage the employees to know that, yes, it's nice to have that right now, but your unemployment will go back to just the unemployment, not the extra $600 after July 31st. So as we start to reopen, we encourage all of our employees to come back to the jobs that they've always had. Does that help answer that question?
Yes, I've heard the cynical comment that they know when businesses will start again. It'll be August 1st because of the deadline you're talking about. It was also mentioned during that call that we have a lot of college students home now for obvious reasons, and we should try to contact as many as we can if we need help. So there are resources out there. We just need to go after them, I guess.
Absolutely. As we reopen and hear what the reopening situation will be, we should encourage the local college students to come and work at the local restaurants, inns, whatever it's going to be that we get to open up. We should absolutely encourage them to embrace what all of us on the call probably remember as some of the best jobs we've ever had is working at our local businesses. So yes, I hope anyone that is listening to me now out there later on the YouTube, please, if you're a college student locally, when we do reopen, we'd love to see your smiling faces in our businesses.
Sorry, I just realized I was on mute. Thank you, Larry. Thank you, Cindy. Does anybody have any more information they want to provide or any questions that they have for the group at this time?
Yeah, Joe, I see Chris is on the line. Can we get an update from the Family Pantry? I know they've been
Absolutely.
doing more than usual, I think.
Chris Menard?
Hi, how is everyone?
As well as can be expected.
Good, thank you.
Thank you.
The pantry is here, as I always say. We are open. We are curbside, so no clients are coming in the building. That's been the case for just about 11 weeks now. So the food is holding out. There's a bit of a bottleneck up at the Greater Boston Food Bank, but they're starting to ship directly from Canada to us, so that's good news. We have a good group of volunteers in the mix, plus we have about 70, almost 100 waiting to come in. I think that attests to the fact that they're all really wanting to get out of the house. We have all of the CDC guidelines in place, right down to, everybody has to take a temperature before they come in the building. Everything is good so far. In April alone, we saw almost 200 new clients, so that was quite a bit for us. That was a big jump over April of last year. There is still some hesitancy with our existing clients to come to the pantry, and we did a little grandma research, and they basically just said that they're too afraid to come out. So we are trying to get the word out to them that we are curbside and that, it is very safe to come here. You basically wait in your car for your very little interaction with other clients, and there's no interaction with volunteers. So far, so good. We're going to maintain this curbside pickup probably for the foreseeable future. We don't actually see moving away from this on the fear that there could be a recession. So we can do this all day, every day. So for the sake of clients and for volunteers, it looks like we're going to stay the course the way we are right now, unless, of course, we see something change dramatically. But as everyone else is concerned about, we don't know what the fall will look like. But so far, so good. No complaints. Going along, fat, dumb, and happy, as they say.
On that note, thank you, Chris. Larry, did you have any questions for Chris or anyone else?
No, it's just such an active center now. It's always good to hear the reassurance that Chris gives us.
Yep, we're doing fine. Everything is good.
Excellent. Thank you, Chris. Thank you, Larry. Anybody else have any information they want to get out to the group at this time? All right, well, I'm going to take that as my cue first to end slightly differently, to say to anyone who is a mom on this call, any mom that watches this on YouTube, and to moms everywhere, best wishes for a well-deserved, happy, healthy, and blessed Mother's Day on Sunday. On that note, folks, everyone, please stay well, and we'll resume again next week. Take care.